One of the people in my Facebook group asked recently if anybody had been turned away from having hip surgery by a hospital because of their weight. You only have to look around you to know that we're getting quite large in the Western world. It's not just us though, it's a global problem that has a major impact on our health and well-being. People who are overweight are much more likely to need a hip replacement than someone who isn't. It's not just the increased load passing through the joint that causes arthritis. Being overweight increases low-grade inflammation in the body, and this can damage the joint cartilage. When we talk about people with weight problems, we use the body mass index, or BMI, to classify them. It's measured by dividing your weight in kilograms by the square of your height in meters. The normal BMI is between 18 and 25. Overweight is 25 to 30, and obese is over 30, with class 3 or morbid obesity being a BMI of more than 40. If your BMI is more than 50, then that's called super obesity. Being seriously overweight increases the risks of all kinds of medical problems, including diabetes, high blood pressure and heart attacks. Many people who are overweight are much more likely to be depressed and have poor mobility as well, which makes things even worse. But what does all this mean if you have a painful hip and need to have surgery? Being overweight does increase the risk of developing serious complications after surgery. These include things like having a wound infection, a dislocation, and having to have further surgery. Because of this, some healthcare providers have set weight limits on who can have surgery. Some say they won't offer surgery to someone with a BMI of more than 35. As a surgeon, I can understand this. If someone's carrying a lot of fat around their hips, then it can sometimes be a long way down to the hip joint. You have to make a bigger incision, which means there's more bruising and bleeding. The operation takes a lot longer, and really it's quite hard work. If you can lose weight before having surgery, it will definitely make my life and yours much easier. But I know it can be almost impossible for many people. If you're in pain and you can't move easily, it's difficult to shift the pounds. If you eat too much without doing exercise, it becomes a vicious circle. So what does this mean for you? If you're on the hefty side, well, there's good evidence that people who are overweight do really well with hip surgery. They get excellent pain relief and improvements in their quality of life, the same as someone who isn't carrying too much weight. After 6 months, the results are pretty much the same. When I see someone who needs a hip replacement and they have a high BMI, I explain to them that if they want to go ahead, then they must understand that they have an increased risk of serious problems. They might have to have multiple operations in order to treat an infection, and in some cases they might need complex revision or redo surgery. The risks are small, but they are significant, and the patient might end up regretting ever had their hip replacement in the first place. Most of the time it doesn't happen, and the recovery is straightforward. Hip replacement surgery has become such a routine procedure. We take it for granted that everything is going to be fine, and most of the time it is. Sometimes though, it's quite a journey, and my job is to help you to understand the risks and benefits so that you make the right decision. If you've got any questions or comments, then please leave them below. Thank you for watching.